Hi, I'm Charlotte Mayor Anthony Foxx, and welcome to The Point. Today, I'm excited to have with me Don Jonas, who's the Executive Director of CareRing. Don, welcome.
Thank you, Mayor.
It's great to have you here, and CareRing is an organization I know so much about from having been involved in some of the activities that they do. But can you tell our viewers what CareRing is, what you do, what your history has been?
Sure. CareRing exists to help individuals establish and maintain good health, particularly individuals with limited resources. We've been in the community nearly 60 years. Used to be known as Community Health Services, and we're now CareRing. And we operate a variety of programs to try to help people maintain their good health. We take it for granted when we're in good health, and if we can quickly get to a doctor or to receive the kind of services we need. But there are literally thousands of folks in our community that don't have those same privileges that we enjoy.
Can you talk a little more about the services specifically?
Yeah, we have three major programs. So we have a clinic that's on 5th Street, and it's a walk-in clinic. We don't accept public or private insurance. It's a self-pay, so $50, somebody can come in and be seen by a doctor or an RN. We have a variety of programs that are within that clinic as well, including a Well Women's Initiative, which is for a very reduced price. A woman can come in and get a whole battery of different screenings and health assessments, which again, that's available to anyone who came into our clinic. We also operate Physicians Reach Out, and this is a network of physicians who have raised their hand and said, we want to see the indigent within our practice. And so we basically run an insurance program for very low-income folks. So we make people find that people are eligible for the program, then we connect them to a primary care doctor. So this is 1,600 physicians, dentists, and allied health professionals in our community that are part of Physicians Reach Out. There's also specialists that are part of this network as well. So if someone comes into a primary care home and they need specialty services, we have additional doctors that are willing to see those patients. Then the third major program is Nurse-Family Partnership. So this is an intensive at-home visiting program for nurses. We go into the homes of first-time pregnant, low-income moms in Mecklenburg County. There are more than 1,000 each year of these kind of moms that could qualify for this program. We're currently seeing 100. And it's pretty extraordinary what we can do. These nurses get into these homes by the 28th week of gestation for the baby, and then they stay with that mom until the child is 2 years old. So they're making weekly visits. As the child starts to get older, it turns into monthly visits, but they really establish a bond and a trust factor and a love and a support system for these moms that really need it.
In the work that you and your colleagues do at CareRing, what do you find about our community that most people may not know? What do you see?
We've got an extraordinary, generous community. I mean, when I look at our physician providers, more than half of the physicians in Mecklenburg County are part of Physicians Reach Out. There is an incredible willingness, there's a drive to try to give back and to help others who may not have been as fortunate as some of us have been. That Physicians Reach Out program, which started 9 years ago, more than $80 million worth of care has been given back to care for folks in Charlotte. Just last year, over $13 million worth of care was provided for free for people in our community through that program. So I'm amazed that, if you establish a program, if you establish a way for people to give back, Charlotteans jump in and they find a way to do it. And we're just so proud to be able to manage that program.
Can you share an example, just a personal example of how CareRing has helped an individual?
Yeah, sure. We did photos for the staff and for some of our volunteers recently, and also for some of the clients that we've served. And I was standing in line to get my picture taken. I'm relatively new at CareRing, and a gentleman was standing behind me, turns out he was part of Physicians Reach Out program, and he taps me on the shoulder and he says, "Don, are you the executive director?" I said, "Yeah, I am." He said, "Well, you saved my life." And I was I'd find out, tell me more what happened. And in this particular case, it was a gentleman who applied for a job. As part of the application for the job, he needed to have a health assessment. When he got the health assessment, he found out that he had some problems with his heart. Then he couldn't get into his job because he didn't have insurance. So he was a perfect kind of candidate for Physicians Reach Out. We got him into Physicians Reach Out. He ended up getting a couple stents into his heart. He is now productive and working, and he's alive. He tells us if he had not found us, he would not have been able to find care in our community and may not be with us. And that's just, it's not me, it's the physicians, and that's what's so great about it. And our staff is extraordinary, but we're just so fortunate to have these thousands of volunteers that come together to help us.
What do you see as some of the biggest issues in healthcare in Charlotte right now?
There are a number of issues, particularly issues that impact the population that we serve. Obesity, access to nutritious foods, these food deserts that we see across our community. There's a great need really for all Charlotteans to be much more active, to be much more physically active. It's all around this prevention. You know, so much of what the way healthcare is geared is towards once a person presents with a problem, we try to bring interventions to save them and to help them and improve them. And that's good, and I'm glad we do that. But so much of what we can do to improve healthcare in Charlotte and really across this country is on the front end before people get sick and teaching them how to live more healthy lives. And we're doing a number of those types of things. I think NFP is the best example of that. We're getting into the homes of these moms that are in very low-income situations, but we're teaching them about nutrition and about healthy lifestyles, and then hopefully passing that on to their babies and to the next generation.
And yet, you know, it's when you talk about prevention, do you think it's that people don't know, or do you think that the ways to prevent health maladies just aren't available to them?
I think it's a little of both. I think it's not true for all the folks that we serve, but many of the folks that we see are in very difficult situation. You know, they're having trouble paying the rent or keeping their car running or finding clothes or keeping shelter for their families, and healthcare is just another thing that comes. And so it's much more of a challenge for many of the folks that we're serving that have extremely limited resources, pulling their lives together and being able to do the sorts of things that we know that are important for prevention to keep them healthy.
What can be done by the medical community to raise the profile on this food desert issue? It sounds like it is one of many issues that structurally prevent us from preventing disease. So what is being done and what can we do?
Well, I think we can start. One thing that I want to do within our organization with others is to start intentionally linking our organization with other organizations in town that have a mission to try to address these food deserts. So for example, when someone leaves our clinic on 5th Street, I would love for them to have information on an organization like So Much Good, which you may know about, Robin Emmons and the work she's doing to try to increase these organic gardens that we can place all throughout the city. So when somebody comes to get healthcare assistance or they go to get housing assistance, why don't we also provide them information on where they could go to get healthy food and how we could address the whole range of human needs and not just, you know, the one issue as they come to our individual agencies.
You know, when you talk about these kinds of collaborations, one of the things that occurs to me is that for many low-income families, and actually people across the board, some folks work 2, 3 jobs. They're running, and nutrition and fresh food and preparation is just feels inaccessible to people. What do you think we can do about that? Anything that from a medical perspective other than just helping people understand the trade-offs?
I think it's raising public awareness. I think within the medical community, I know there are an awful lot of folks that are starting to realize that, you know, if somebody presents and they have obesity or they have other health maladies that have occurred because of their diets, it's oftentimes easy just to write a prescription, say, you know, go and take your beta blockers, but what we really want to do is have kind of a revolution within the medical doctor's office so that they can address, you know, what are you eating at home and what kind of meals are you serving for your children when you're there, to really have a sort of revolution. And it can happen. We can immerse this within the community, within the schools, and within the businesses and the nonprofit community and the faith-based community, that we can really, that's the one way we're going to make a difference, a really big difference long-term on the quality of the health and the health outcomes within our community, is going at it holistically as a community on prevention.
Tell me about what kinds of other healthcare innovations you're seeing taking place in Charlotte.
Yeah, it's great. You know, Nurse Family Partnership is part of a family of, the county has Healthy Families, the YWCA has a program as well. There's a number of different agencies in town that are recognizing just how important it is to go into the homes of lower income folks to help them become better parents, to help them address some of the health needs that they have within their families. And so there are many of us that are recognizing on the very front end, the first few years of life, there's a huge opportunity to make a difference in people's lives. We happen to think with Nurse-Family Partnership, we've got the gold standard. I mean, this is something that it's in more than 30 different states. It's been around for more than 30 years. And it's not just a healthcare innovation. That's what's great about NFP. You know, it comes in as a nurse who's there to help with healthcare needs of the family. But when you start to look at the long-term trajectory, the outcomes of the children, the NFP babies, I mean, they're getting incarcerated at lower levels. They're staying in school longer than those that are not an NFP. They're getting into the workforce. And it's all because it's this very intensive intentionality of going into the homes to help people in need.
Speaking of Nurse-Family Partnership, I've actually been on a visit.
I'm going to one this afternoon.
Which is amazing.
Yeah, it's pretty
to
amazing.
see the nurses and the families interacting with each other. How do we scale something like that? I mean, clearly the need is much greater than current resources allow. What do we do to scale it?
I'm glad you asked that question. So one of the things that I want to do is to talk to our elected officials, to our county. NFP across the country is oftentimes run out of county health departments. In some cases, it's through funding that comes from the state level. We've been extraordinarily the benefit of extraordinary generosity from a number of major foundations, the Duke Endowment, Blue Cross Blue Shield, many others, Sisters of Mercy, that have invested in this long term for us to be able to serve the number of families we can. But there are great opportunities at the public funding level perspective, but also other individual philanthropists, other individuals that have a particular heart for trying to reverse poverty. I think there's a great opportunity. So we're seeing 100 moms right now. We have 300 moms that have been through this program. We would like to see many, many more moms. If it's 50 more moms or it's 100 more moms, we know the need is there, and we know we've got a model that works. We just need some support from other sources to ramp it up.
Well, I tell you what, Don, Jonas, you're doing a great job over at Care Ring, and all of the folks over there. We want to say thank you to you and all of your colleagues. And this is Anthony Foxx with a great segment on the Care Ring here at The Point. Thank you.